another sort of nuance, and that is, how do you make sure that it's appropriate for right and left side? I don't know if you guys have experienced that, but that is something that needs to be considered as well, because you're mentioning some strength and some endurance differences potentially.
Hey everyone, my name is Dr. Nick Halsey with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
Or hypertonality. I don't.
Sure.
It's not coming to mind. Yeah.
That's okay. That's okay.
So.
Okay.
Nothing.
Well, the other thing too, I mentioned, well, actually I have a note here that you guys might have a couple of very specific questions for me.
Yeah.
And I'd be happy to go through those, because again, like I said before, I don't know if you were here, my main goal is to be a resource for you guys, to answer any questions you have, help you get the most out of this. And so with that in mind, I'd like to just make sure I get your sort of really, really important questions answered before we dive into any sort of assessment level types of things.
Oh, okay. Let's see if I can pull it up in my brain.
And if we need to go through assessment, that's fine too. I just want to make sure that I want to be respectful of your time and make sure that we're able to get, kind of the most salient things addressed.
Gotcha. Yeah, I think our major things are just dealing with the kind of dealing with both hands and kind of how do we adjust things for that, and then kind of the some of the manual things of not having the access to both hands kind of makes some exercises a little bit different or difficult, but that varies. So like how do we make those adjustments on the fly, sort of. So that's really the kind of a lot of like more like meat and potatoes of maybe like the right word. More like practical questions more than anything.
Sure. Yeah, I think that reasonable questions. And so I think what we can do is with regard to those exercises that do require multiple hands, we can maybe forego some of those exercises in favor of ones that are require a single hand. That being said, the games will also sort of auto select if you are not able to do that. And so it's not like it's going to prevent you from doing the exercises. For instance, one of the card games, it will select cards for you to play if you have trouble using the hand that is not in the Motus hand, for instance.
Sure.
So there is.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro-rehab.
We were just saying that like because there are differences between like the strength, especially like endurance in left and right. Sometimes when we're set up for, let's say, the right hand, if we're in just the right position, he has full access to pressing the buttons, but it might take a little bit longer. So in those cases, we're trying to think like, oh, would it be helpful to maybe extend the timer or to so like those sorts of granular questions where I'm not sure that's obviously that's not open to us right now, but we're not even sure if that's a possibility.
Whereas that's a good point.
Right hand, it's kind of maybe we're not even talking. Like he might do it for a couple exercises, but for the multi-tap ones like cards, that might be harder for it to sustain over.
Yeah, exactly. Now I think that that's really good feedback in terms of insight, as we can always try to improve the individual games, the exercises. And so I think, I was actually just getting some feedback to the software team earlier today about some of the speed of the various exercises too, in trying to make sure that the speed is an appropriate, is at an appropriate level for individuals. And so I think that idea, that timer, is also a very, very important one as well. So I appreciate that comment. I'm going to make sure that the software team gets that as well. Just taking a couple notes here to make sure that it does get transmitted here. Okay, very good. And then in terms of sort of maybe encoded in your question, is another sort of nuance, and that is, how do you make sure that it's appropriate for right and left side? I don't know if you guys have experienced that, but that is something that needs to be considered as well, because you're mentioning some strength and some endurance differences potentially.
Yeah.
And so what might need to happen is, we may not be able to do that all right now, but we may need to do an assessment on the right and the left side and have settings that we can adjust to each of those arms whenever we are using the right versus the left, because we want to accommodate, sort of personalize its right and left side. I will say this, that the Motus Hand is not necessarily designed to do this, but there's a way we can make this happen. You can go in and in the settings tab, we can go in there and manually change those.
Gotcha.
So that's an additional step that needs to happen, but it's certainly possible. But what it does require us to do is, it does require us to have insight into what those numbers would be for each side.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.